So today we'll be going over the nosebleed kit that you may be sent home with if you ever visit Sinus and Snoring MD for nosebleeds. So today, a couple of things in this kit. The number one most important thing in this kit is the red bottle. Try and remember red for blood, all right? This is essentially the exact same thing as Afrin, but what you do is if you're actively having a nosebleed, what you do is you take out the bottle, break open the cap, and tip it up into your nose, getting 2 good sprays on both sides, regardless of which side you're having the nosebleed from, okay? 2 to 3 sprays is usually sufficient. Next, take a cotton ball, actually unroll it so that it's long. You can take the same bottle, that's the red bottle, and really douse it in the Afrin, okay? Both sides. Then you take the cotton, break it in half, and use the one half to shove it up the one side of your nose that's bleeding. While it's in your nose, hold pressure on the bridge of your nose. A lot of people think you need to hold pressure higher on the bony part, but it's not going to do anything. Make sure it's right below where the bone ends so you can actually squeeze. Then holding pressure, lean forward, not backwards. If you lean backwards, the blood will actually flow down the back of your throat, and we don't want that. So lean forward so it helps clot the blood and help stop the bleed. Usually you can hold pressure anywhere from 15 minutes to 1 to 2 hours just to ensure the nose bleed has stopped. Save the other half. If you're having blood coming out of the other side of your nose, you can put it in there before you hold pressure. Otherwise, keep it handy in case when you remove the cotton from the one side that's bleeding, you can put it back in if it's not quite stopped yet, okay? Now, in this nosebleed kit, there's a couple other things that come with it as well, okay? The yellow bottle is just a saline gel. Now these other things in here are more so to prevent nosebleeds rather than stopping an active one, okay? So this gel, essentially, you take it out, you can either put a little bit on your finger or on a Q-tip, and it works really well for just keeping the moisture in the front of your nose, okay? So you don't need a ton, you just break it open, pierce the top with the top of the cap, put a little bit on your finger, and then just in the entrance of your nose, okay? You don't need to shove it really far up in there. If you put it in there, you can sniff inward a little bit as well, but this gel is actually designed to go in the nose, okay? Usually, we'll have you do it, anywhere from 2 to 3 times a day just to maintain that moisture, okay? For the purposes of getting further up in the nose, we also provide you with a little bit of saline gel, okay? The key to nosebleeds is moisture, 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 okay? So essentially taking this bottle 2 to 3 to 4 times a day, just a quick spritz on both sides of your nose just to maintain moisture, okay? A lot of times we have our patients doing actual irrigations. We kind of want to avoid irrigations at this time because what happens is when you have a nosebleed, a crust forms over the site that's bleeding. If you do an irrigation, sometimes it shifts that crust and causes it to bleed again. So we want to leave the crusts in place, let them heal as best they can. Usually it takes about 2 weeks to actually heal on their own. So in addition to the actual nosebleed kit itself, we also have you doing light activity, no nose blowing at all, kind of just taking it easy as to not disturb the crust in the nose, okay? As far as the Afrin, the red bottle you can use it as many times as you need to for an active nosebleed. Otherwise, this Afrin can also be used for congestion, but for those purposes, you don't want to use it any more than really 3 days in a row because it can actually make congestion worse. Which is a common misconception of Afrin in general. Again, this bottle doesn't actually say Afrin, but it is the exact same active ingredient which we provide you with, okay? And then if you have any questions, you can always feel free to call the office. We're happy to answer any questions you have. So a couple commonly asked questions, one of which is, should you come in if you're having frequent nosebleeds, you or your children or teens, right? With frequent nosebleeds, what usually happens is that you have the first inciting nosebleed, right? Future nosebleeds are almost always coming from the exact same site that was bleeding. That site, like we kind of talked about in our previous video, is usually a crust that forms over it that shifts and then bleeds again. So it's actually bleeding from the exact same spot. So if you're having recurrent nosebleeds, absolutely you should come in. Another option is, what can we actually do for nosebleeds, right? If we can actually identify the spot in your nose that is bleeding, what we do is we can actually take a little bit of silver nitrate, which is basically chemical cautery, meaning that we basically burn over the area. We numb the nose first, so it's very, very minimally, painful at all. You might feel a slight little sting at most. But essentially, by burning it over, we seal off that vessel, allowing it to heal over appropriately. And following that, of course, we have light activity, not blowing your nose, not disturbing the nose as much as possible. Okay. Once we do chemical cautery, it is likely that you might have one more nosebleed as that future crust comes off. It would be a small one, and then usually you're good. Occasionally, it does require some touch-up cautery, chemical cautery over the nose, but relatively infrequently. Okay, there are more invasive ways of cautery if it were severe, but for the majority of patients, I would say that chemical cautery is our primary way of solving that, in addition to maintenance moisturizing. Humidifiers work awesome at home as well. Other saline gels, saline spray, anything in the nose. You cannot over moisturize your nose. Okay. Common causes of nosebleeds is also another question. Especially in winter, we see a lot more people for nosebleeds right now, primarily because of how dry it is in the nose, right? When your nose is dry, there's cracking causes bleeding, and then it starts the whole process of scabbing, and then it bleeds over and over again, okay? Other things like trauma to the nose, our fingers up in the nose can cause some scratches, which can bleed. Anything that disturbs the nasal mucosa when it's not moist, that's why moisture is one of the primary treatments for nosebleeds. Another scenario, is if you come in and you're having frequent nosebleeds and, maybe you're on a blood thinner, perhaps, and we don't want to, cauterize the area because it does cause, an injury to the nose. Sometimes we will send you off with a nosebleed kit and we will, leave it and let you just keep moisture, and then let it heal on its own, right? If we can identify a spot, we can only go so far in the nasal cavity with silver nitrate. So, but if we can usually identify a spot, we will cauterize it on site. Okay. Are signs of nosebleeds potentially suggestive of something worse? Okay. Most commonly, nosebleeds are benign, meaning that they happen to happen. A lot of people get nosebleeds. Usually, people have nosebleeds once and then it stops and heals over. In very rare events, it can be something more significant, especially if you have a history of certain masses or things in your nose, things like that. Potentially cancer in the nose can cause nosebleeds. Very uncommon though. The majority is from dryness, cracking. Having a deviated septum can predispose you to having nosebleeds, for example, just not having a lot of room in your nose when tissue is constantly pressed up against itself. But again, most commonly it's just from dryness. Thanks for watching, guys. If you have any questions at all, feel free to visit sinusandsnoringmd.com.